cosmetic services that we offer in our office are a combination of fillers, the relaxants for the facial muscles like Botox and Xeomin. It's actually it's called botulinum toxin, and it is a medicine that we inject into the muscles, cause them to relax, so therefore the facial wrinkles start to decrease on the face. Pretty much, yes. It's human chorionic gonadotropin. It's a medicine that we use in our office to help with weight loss. It's technically not FDA approved for that reason, but we go ahead and use it to help suppress your appetite and allow you to eat a very low-calorie diet so you can lose weight rapidly and feel better about yourself. And it's another tool that we use for weight loss purposes. What they do is give you a complete balanced meal in a very low-calorie or calorie-dense type item, such as a shake or a bar or a snack of some sort, and this allows you to restrict your calories and go ahead and lose some more weight. It's a medication that we utilize to help you to lose weight by decreasing your appetite and therefore allowing you to make better food choices or meal replacement choices so that you'll lose weight. Those are technically not made by a pharmaceutical company, they're made by a nutraceutical company, and they allow you to use different herbs and other type non-medical components to help you lose weight. It's very difficult, and we understand that, and that's why we incorporated that into our office so that we can help you out and follow you medically and make sure that all of your medical problems are taken care of as you lose weight and adjust your medications as necessary. Sure, it can be, but again, we feel like having a doctor monitor you throughout the process is probably the better choice for most people. That's where often people find that they plateau because their body starts to hold on to everything that they're taking in, and so that's when we can make some adjustments in your plan if we're following you for your dietary plan and hopefully restart the weight loss process for you. It's important that they know that because they want to utilize their insurance products, and so we want to make sure that we can file for them and get them taken care of in a timely manner and with as little expense as possible. Well, we have different wellness visits depending on how old you are. If you're a child, you come in for your regular checkups in a certain schedule, and that might include immunizations, measurements of their height and weight, graphing all of that out, making sure that they're growing appropriately, and answering all the questions that the parents have. Well, woman exam is your typical pap smear and breast exam, and then we also order up a mammogram if it's appropriate for the individual, and then depending on the individual we might get some blood work or some other wellness type approaches for them depending on their age. Absolutely. We do complete physicals on both men and women, and that's going to include, depending on their age, a full exam, blood work, possibly an EKG, possibly referring them out for a colonoscopy. It just depends on what they need. Well, unfortunately, it depends on your age, but the older you get, the more often you should be seen by your doctor. But we recommend at least an annual physical for most people. Well, mainly it's checking their blood pressure, looking at their height and weight, looking at their overall health, looking at their overall medical conditions, making sure that they're being managed appropriately, and then doing a complete exam to make sure nothing has changed over the year previously. Well, chronic pain most times is treated by the pain management specialist, but we do also help to manage patients that have chronic pain conditions, and it just depends on the individual and what's going on with them as to who's going to manage them the best. Well, actually it's already here depending on what time of the year you're looking at this, but in Houston it's almost year-round. But what we have added into our office is allergy services that both diagnose what you're actually allergic to and then help you to desensitize to it through immunotherapy that you actually administer to yourself, so you're able to decrease your allergy symptoms over time. Well, we bring you in for the initial visit, and we go ahead and do the testing to determine what you're allergic to, and then we have a whole schedule depending on how rapidly we're desensitizing you to the particular allergen, and then we bring you in based on that. So it just depends on the individual. Oftentimes people will have symptoms such as sneezing, itchy, watery eyes. They might have a dry cough that they can't explain. They might have just not feeling good, feeling kind of woozy or out of it because their brain just feels like it's in a fog. They may have chronic sinus pain. And then also there's different forms of food allergies that we address depending on the individual. They're actually a line of cosmeceutical products that is made by a Florida dermatologist, but we got interested in them when we started doing our cosmetic aspect of our practice, and we decided that we were able to put our own brand on them and choose which products we chose to have here in the office, and so therefore we have them available for purchase at the front office. Some of them are retinol type products that work on wrinkles. We have some that like a lipid drop that helps with hydration. We have a couple that help with tightening up the skin, and we have some called Neutrophil that helps to actually help fill in some of the deeper lines on the face.